Good morning, everyone. And I want to thank everyone for coming today and hearing some of the updates that we have had. So ironically, this upcoming Friday will be the second week from our first press conference. So with that being said and putting things in perspective, we put some initiatives together roughly 2 weeks ago that started the process of what our plan was here in Monmouth County. At first we started, and it's similar to somewhat of a strategic plan that we put together, and with changes that we knew were going to occur. As we said, that big word, that focus word, crystal ball, we do not have one, and this is changing daily. With that being said, we do have some numbers that we received last night on the state level. And on the state level, there was 12,000 people in the state of New Jersey that were tested. When I say tested, that means individuals that had the symptoms and the two major symptoms, which were the fever and the breathing issue. With that being said, the other ones, they were obviously, that doesn't mean that they were not positive, but they were told to go home, quarantine, because of the dangerous situation that they had at that time wasn't as strong as the ones with those two types of cases and symptoms. With that being said, out of the 12,000 that tested for the COVID-19, approximately 3,600 tested positive. That's roughly around 27%. 73% tested negative out of there. So with that being said, that does not put us at a level of relaxation. It just puts us a level that we're getting a grip and we're moving forward. Those numbers are going to rise. And take today for an example, I think we'll start seeing our first batch of the PNC tests coming back. So we anticipate the rises, the numbers going up at that period of time. I'm surrounded here with my professionals here and my staff, Deputy Director Sue Kiley, here working hand in hand, along with our other freeholders. And we are taking that approach of that social distancing. That's why you see the two of us here today. The other three freeholders, 100% are supportive of all the initiatives and are part of every initiative that we do. We have our County Clerk, Christine Hanlon, to talk to us a little bit about some election issues that are coming up and concerns to our municipalities. We have our Sheriff, Sean Golden. We have Chris Merkel from our Health Department and our Administrator, Terry O'Connor. First and foremost, it's very important to me because as we are all concerned at home, sitting, seeing what's going on and listening to the TV and reading the newspapers, our essential workers are out there working to try to keep us safe out there. So a lot of the directions that we take from the state. We work together hand in hand there, and then we implement some of our initiatives. So some of the challenges that are going to arise as we are seeing here, and as we rely very heavily on our tourism industry, which doesn't just affect our people here in New Jersey, but in our surrounding states, in New York in particular. As we know and we hear, the impact that this is having on New York City and the quarantine that they have there. With that point being said, we are starting to see numerous people coming down to their shore homes. Okay, that's a concern. That's a major concern because let's be responsible and common sense here. All right, if you're being quarantined inside your state, okay, we do not want to move and come here and extend the period of time that we're going to have here because people are moving. And I understand the difficulty, okay, of staying inside your house. But let's put things in perspective on what the long-term issue is here and concern and what our total initiative is here. Make everybody healthy and get everybody healthy. Social distancing, as you can see here today, is a huge part of what we're conveying there. We're giving all our employees the ability to talk to their department heads and make sure, give opinions to their department heads on ways to make it better if need be. We're working, Terry O'Connor and her staff is working with completely on a day-to-day, hour-to-hour, minute by minute, working with our employees. We have numerous things that we're working on with our municipalities. Every day, every time we have this press conference, prior to our press conference, I go on a conference call with all our mayors here in Monmouth County and our legislators to discuss some of the initiatives that we move forward with. We're continually looking at ways to make it safer and more protective here in Monmouth County for our residents and our employees. Some of the initiatives that we've put out to our mayors is to grab the data of the contained senior buildings. Sue and myself and our administration are working on a program that we know potentially could be an issue looking down the pike on feeding those seniors inside those buildings there. We have a great base led by Sue Molione from our social services, working hand in hand with our food pantries and working with our municipalities, working with Interfaith Neighbors, doing a tremendous job helping this county out here and assisting this county. But we will continue to work and do everything possible on a day-to-day basis to make the changes that we need be. And, you know, and I know in my early stages, I talked about that crystal ball, and when I said that, I did not know how important that really was going to be. Because I have to tell you, it changes daily. Our conference call with the state of New Jersey, which we'll have another one today at 12 o'clock, continues to change daily. And as those numbers change, our initiatives will change daily. There's a lot of information that comes out of Office of Emergency Management, comes out of our clerk's office. All those need to be presented to the public. And that's why it's important for us to hold these on a regular basis, to get that information out, to get that unknown information cleared up in people's minds, in our municipalities' minds. And that's why we're taking this initiative to convey that message on a weekly basis. So before I come back and I lead this on, I'm going to call our sheriff up to give a little information on what's going on in the emergency service side and in his department. Thank you.
Freeholder, thank you so much. Again, thanks to the media for always getting our message out to our residents. As you know, and it is no secret, both in the state and around the country, PPE gear, personal protective equipment, is needed for our healthcare professionals and our first responders. It is a shortage not only here in New Jersey, but around the country. And as such, we are doing our best from our county emergency management team led by Mike Opegart to be sure our first responder and healthcare providers have that gear in hand. That said, today we are announcing a donation drop-off point, which will be stationed at Thompson Park in Middletown, Lincroft area. It will begin today. That donation drop-off point will run from 9 a.m. till 4 p.m. every weekday for the foreseeable future. In addition to that, if you have some gear that you think may fit the criteria, or even if it is close, please call our hotline for this donation point. That hotline, which will be distributed via press release, is also 732-842-4000. 732-842-4000, extension 4312. That will be for any of the donors that wish to donate to the drop-off point and have questions about material needed. Now, we will have flyers that will end up around our communities on our websites and social media that outlines exactly the PPE gear that we are looking for and soliciting for our first responders. Again, all of that gear that we receive in donations will be put together in packages. Some of you have saw that process in this very facility that we do, package those kits and then distribute them out to our first responders in the various towns in our county. Those supplies include nitrile examination gloves, surgical masks, or more importantly, N95 masks. As you know, you've heard this term, it's become a hot commodity. Protective gloves, protective face shields, multifunctional non-contact infrared thermometers, hand sanitizers, and antibacterial wipes, as the first responders need to wipe down all of their equipment after every call and do that all over again with desanitizing all of those pieces of equipment they use when they're out there. So again, more information will be released on the press release Monday through Friday, 9 a.m. to 4 p.m., Thompson Park in the Monmouth County Park System located in Lincroft. There'll be a drop-off point for all of those items that are listed on the list that we will send out to you. With that said, Freeholder, I think that's it. Thank you.
Thank you, Sheriff. So as I want to commend our Sheriff and Mike Opegard and his department at OEM for the way they're handling and working with our municipalities. And so, we have to keep things in perspective here. We have to look at, we have a lot of volunteers that we're all very proud of in the 53 municipalities. But in the same aspect, we have to keep them safe and keep them harm's way from eventually catching this disease because quite frankly, we need them. So, it's a plea. It's a plea to our business world for assistance there. And our sheriff is doing a great job reaching out to them, and they're coming through. And I think after this press conference, we'll see more and more coming through because they realize the importance of those individuals. So as time goes on, and as this virus moves and prolongs, dates come up, very critical dates through the state of New Jersey, and more importantly here in Monmouth County. And elections is one of a big topic that is about to come up there, and a lot of information has to be conveyed out there to our public. And that's why we thought this is a perfect time and a vital time for our county clerk to come up and give a presentation and an insight on some of the information that she has to convey. Christine?
Thank you, Freeholder Director, and good morning, everyone. For those of you who know, the County Clerk's Office has many statutory requirements that we have to fulfill, including our property recording office to keep people being able to refinance their homes, conduct closings, and very importantly, our elections office and all of the election offices that we have here in the county. So I first want to thank the many employees, the 70 employees of the County Clerk's Office who are doing their best under difficult circumstances to keep our operation going as best we can for the public at large. I want to thank Freeholder Arnone, Deputy Director Kiley, our Sheriff Sean Golden, Chris Merkel from our Health Department, our County Administrator, Terry O'Connor, for all of their leadership in getting us through this very difficult situation that we're in right now. I also want to especially thank, because of the work that we do in the County Clerk's Office, John Zawatsky, the Director of our IT department in the county, because as we all know, IT is one of the most critical functions that we have right now to keep us all going and connected. I want to also thank our Public Works, keeping our buildings clean, letting us get into our offices, and our emergency management all around the county. With respect to elections, Governor Murphy last week issued Executive Order number 105, which had two components with respect to the election process. The first has to do with the May 12th nonpartisan elections in Monmouth County, which affects over 7,000 residents in Monmouth County. On May 12th, there are 4 municipalities in the county that have a nonpartisan local election, and those towns are Allenhurst, Deal, Keansburg, and Lock Arbor. The executive order mandated that this election will be conducted entirely through vote by mail. That means that over 7,000 voters in those towns, both active and inactive voters, will be receiving a mail-in ballot for the May 12th election. There will not be any polling locations open whatsoever on May 12th. One of the other requirements of this executive order is that all of the ballots must have a postage-paid return envelope. So we will be working to ensure that all of the return envelopes are postage-paid. I just want to point out my app, Monmouth Votes. Voters can find information on that app anytime they need elections information. And they can also call my elections office, 732-431-7790, or visit monmouthcountyvotes.com, which is my elections website. The other component of this Executive Order 105 had to do with the primary election insofar as candidates need to be filing petitions to be on the ballot for the June 2nd primary election. First of all, there was no change in the executive order with respect to the March 30th at 4 p.m. deadline, where all candidates up and down the ballot need to have their petitions in, either to the Secretary of State's office, the county clerk's office, or the local municipal clerk, depending upon the circumstances. There was also no change in the amount of signatures required for petition filing for each elected office. The major change of the executive order had to do with how candidates can collect petition signatures. And in order to limit contact among people, especially when we're in a situation where people are supposed to be at home, candidates can now collect their petitions electronically. The forms and instructions for the electronic collection of petition signatures can be found on the State Division of Elections website, njelections.org. And there is a list of instructions for the petition collection electronic form. You can also contact my office, again, 732-431-7790 for more information about that. The notary requirement for petition signature circulation is also waived for this particular election. It is important for candidates to know, though, that this form is only for petition signature collection. Candidates also have to complete the other required documents, which include the certificate of acceptance of a candidate and what's now called a pledge of allegiance of a candidate, which does not require a notary signature. Another important change in this executive order is that all petitions must be able to be filed electronically. So if candidates are filing their petitions with the Secretary of State's office, the Secretary of State must accept electronically, and the same goes for my office, where all of the county petitions are filed. We will accept electronically, and every municipal clerk throughout the state must accept petition filing electronically. Thanks, everyone.
Thank you, Christine. That was very informative. And I know her office is being inundated with these questions because obviously this is a process that none of us have been through. And I thank you and your staff on how you're handling so professionally and dealing with our municipalities and giving the clerks the information they need. So as we know, we have an office, a Board of Health office, and it's led by Chris Merkler. And before I bring him up, I want to say live, I want to thank him and his staff and all our staff. But this staff in particular is right on the front line here, dealing with numerous questions outside the box of their normal day-to-day operations for sure. And the way they're handling it, I couldn't feel that could not be in better hands than we are now. So Chris, I'd like to call you up to just give a little update on the health side.
Thank you, Director. Thank you, Freeholder Board. Thank you, Sheriff. It's really been a cooperative effort amongst all county departments, so I'd like to thank everybody who's been assisting myself and my staff. As the Director said, this is an ever-changing situation, especially on the public health side. As you can imagine, our messages, our public health messages will change as this situation changes. The number of cases continues to rise in New Jersey and in Monmouth County. This increase is expected. to continue. As more testing is completed, we will see the number of cases go up. At this time, our public health efforts continue to focus on slowing the spread of COVID-19 here in Monmouth County. We have been in contact with first responders, including emergency medical services, law enforcement, healthcare providers, healthcare systems, school officials, municipal officials, local OEM coordinators, and other health officers here in Monmouth County that we are working with. We continue to update our emergency contact list to ensure all community partners receive timely information updates. We are sharing information from the Centers for Disease Control and the New Jersey Department of Health on a daily basis. Health Department staff is actively working to identify high-risk contacts of confirmed cases here in the county. As part of the risk assessment and public health management of persons with potential COVID-19, public health personnel conduct interviews and assess these individuals for fever or other symptoms of COVID-19. If the asymptomatic close contact reports fever or symptoms, they will be considered a person under investigation and referred for further medical evaluation as deemed appropriate. The Health Department participates in daily phone calls with the New Jersey Department of Health and a weekly call with the Centers for Disease Control. These calls provide situational reports and provide updated guidance. This message is for our younger county residents. A Centers for Disease Control study published last week, March 17th, shows that younger people can develop serious COVID-19 illnesses requiring hospitalization. This finding is different from the first reports in China. Younger people who become ill can also affect their parents and grandparents who may be at higher risk of dying from the disease. That is a very important message for everybody out there. The Monmouth County Health Department has opened a phone bank to take questions. As you are aware of, the phone bank is still open Monday through Friday, 9 a.m. to 8 p.m. And again, the phone number is 732-845-2070. Health Department staff, Medical Reserve Corps volunteers, and crisis counselors are available to answer questions. Everyone can do their part to respond to this threat and slow down the spread of this disease. Follow the guidance for social distancing. Stay home as much as possible. Continue to wash your hands frequently with soap and water. Cough or sneeze into your sleeve, and routinely clean frequently touched items, doorknobs, light switches, remote controls, cell phones, and countertops. And I like to end by again saying this is an ever-changing situation. It changes minute by minute. So it's important that us in the public health sector and the residents are doing their part to slow this spread. And our message will continue to change as appropriate. Thank you.
Thank you, Chris, and thank you again for your work. And Terry O'Connor, thank you for your assistance with Chris and his staff there. So this is a big county. It's a large county, and it has a lot of geographic areas here that we have to deal with, and a lot of departments that we have to deal with. And myself, as the director, cannot do that alone as the leadership of the county. And I'm very fortunate to have a deputy director and Sue Kiley here working hand in hand along with our other freeholders. And Sue has some information that she would like to convey to the public. Sue?
Good morning, everyone. First and foremost, I'd like to say that on behalf of the team, our thoughts and our prayers are with the people that are suffering from this virus and our first responders and emergency personnel who are putting themselves out there to make a difference and help our communities. We are very, very grateful to you. I also want to reiterate the importance of that protective gear that we're requesting and ask everyone to do whatever you can to make sure that that initiative is successful. As a former emergency room nurse, I know firsthand how important that protective gear is. And we should be treating everyone we come in contact with as a positive case of COVID virus. So it's really important to have that gear come in as quickly as we can. There are other ways that you can help, and you've already heard from our health department that staying at home is your best way to avoid this virus. But if you think to yourself that everyone you come in contact with is positive, just use that as a rule of thumb, and it will help you to really think about how close you want to get, how much you want to protect yourself so that we can stem the spread of this virus as quickly as possible. In this time of uncertainty, we have some residents that have said they're kind of falling into a new routine because they have to. We have other residents that are experiencing tremendous anxiety and stress, but don't necessarily want to call themselves, quote, in crisis, so they're not reaching out to the crisis helpline. Through the organization of Monmouth Acts, which was created recently by the county, which is a collaboration of private and public organizations working together to help our residents. We've had a conversation about creating a helpline that you can call if you just want to talk. You know, you just want to vent, you just want to ask a question, but you don't necessarily consider yourself in crisis. You're going to hear a lot more about that. We will get information out, we will get a phone number out for you to be able to use to access that kind of a conversation. The other thing is that on the aging side, the Office of Aging has been tremendous in proactively looking at the seniors that require food that may have congregated in the past to have their meals and can no longer do that. So 3 weeks ago, the department proactively started putting together some plans with outside agencies, with the state, to be able to deliver meals. I think we're up close to 500 that are on that list, and they will start getting meals as of tomorrow. If you have people in your community that you know need meals, you can call into the Office on Aging. I'll give you that number. It is 732-431-7450. And they will make arrangements to make sure your loved one or whoever you identify is able to get food. They're also going to be collecting emergency contact information. And I would urge you as family members, if you know you have a family member in need of food, do what you can, or make sure you let us know about it so we can make sure they're fed. The other thing that I want to talk about is there are a lot of questions that have been coming into the helpline that we might be able to help with now that just are very common, and we hear them asked often. The first is, what do I do if I have symptoms? If you're experiencing symptoms of fever, difficulty breathing, tiredness, and cough, you should contact a testing facility or your healthcare professional first. There's a lot of telemedicine going on. Your healthcare professional can help walk you through what you should do next. And they will pre-screen you before you go for a test. The second question we get a lot is, how long does it take for results to come back? And obviously we've had some variation in that based on volume. If you've had a COVID-19 test administered, it usually takes 4 to 5 days to receive your result. The testing facility will contact you with your results. If you do have a positive test, the testing doctor will contact the New Jersey Health Department and notify them. Can I get my results from the Monmouth County Department of Health? And the answer to that is no. The Monmouth County Department of Health does not receive the results and cannot provide them to anyone. So if that's the reason you're calling, you should wait to hear your results from the person that actually did the test or your physician. We've had questions about businesses that are remaining open and, a resident feels that they shouldn't be open. That is also not a question you would ask the health department, but anyone who would like to report a business that is not complying with the governor's executive order can call the Attorney General's office, and I'll give you that number, which is 609-292-4925. So that answers a lot of the most common questions that we're hearing that are unrelated to the COVID virus itself or a helpline. As always, we ask that you get your information from credible sources so that you have current and accurate information. And those sources would be the CDC, the New Jersey Department of Health, or the Monmouth County Department of Health. Thank you very much. Appreciate the time.
Thank you, Sue, and thank you for all you're doing here for the county, too. So, in closing, you know, one thing I want to touch on, because it seems to be like a very hot topic that people are really recognizing, and I understand why. Coming from a small town and being a mayor in a small town, you're isolated to your town and the numbers. And that's seems like a very, very important part of what everybody's looking at now. Let's take a county-wide initiative here and not look at those numbers. And people will say, well, why would you want that? What would be the reason for that? Because we're looking at numbers and we're looking at the population of our town and saying, and our young people in particular are saying, oh, it's not that bad, okay? But what they're not knowing is, as Chris said to us earlier, is how they're being tested with the symptoms that they're being tested with. So let's put that in perspective to the ones that are not being tested but are out there. Those municipalities do not know that. The numbers are not calculated, so they're not put in those numbers. So as Sue said before, let's look at it. Let's take a few-week initiative here, and hopefully that's it. Maybe it's longer, okay? But as we sit here, let's take and look at it as stay away from everybody, let's social distance from everywhere, and our county has an issue right now. County-wide, and our 53 towns do. And let's regulate it that way. We're going to run into some situations where we're going to need some help. Okay, our staff is working very hard, but at the end of the day, we got to keep them safe and healthy. So we're asking for help from any licensed nurses who either at home or retire to volunteer with our Monmouth County Health Department and to do case management or help in any capacity. That would be very helpful. We ask any nurses who are willing to volunteer to please call COVID-19 hotline at 732-845-2070 or email monmouthcovid19@visitmonmouth.com. So in closing, I think what we need to do here, and I think the initiatives that we're going to take part of here, is we're going to work with our municipalities to look at a way that we could initiate a program for those contained facilities, utilize our businesses that are open, and maybe be able to give them the resource of some business then. I look at the people out there that utilize our businesses when we're going out there for, to ask for donations to different businesses out there. This is the time we need to help them, those businesses that are open. Social distancing and takeout only, as I have to state here. And you know, I'm going to go back to that other scenario that I started off with in closing, and that's our responsibility as leaders of this county is Monmouth County. And if I offend people when I say this, I apologize, but my job and what I was elected for was to make sure the people in Monmouth County are safe. And I know that we will have that, and we're not going to be able to control people from other states coming in because of the severity in their state. But let's keep one thing in mind. If you do come here from New York, and I'm going to use that as one of the states, or Connecticut, or Philadelphia, or Pennsylvania, wherever you might come from, okay, there's a 14-day self-quarantine that we hope you respect here when you come into New Jersey, and more importantly, here into Monmouth County. So with that being said, we will do this regularly. We will give the people of Monmouth County the information they need and they want so that they're kept safe and continue. As I say to everybody, all the 630,000 people in Monmouth County, think responsible, think smart, and stay safe. Thank you. Sure. Thanks. Thanks, Sheriff. Is there any questions? Sue? So I'm going to leave that to the sheriff.
Only this question, otherwise they can just drop it off.
Yep.
Another one is, some towns have been closing their boardwalks.
Yes.
Are there any intentions of closing, I know there's people that use the boardwalks as to get outside, to have activity. Are there any intentions of closing any of the parks?
So let me stand where we're here at the parks. So what we have done, the initiative we've done, we've closed our county golf courses. We've taken all the playground equipment and boarded it all off. Okay, we are leaving walking trails and those period of time so people could get some air. We have to look at the mental healthness side of this, okay? And realistically, we're all here now. So guess where we're not? We're not in our homes, sitting cooped up at this moment. But there are a lot of people that are. And today, in a dreary day, it's not that bad. So if we could give the ability for people to be outside, social distancing, through our park system for the time being, and the crystal ball comes back in. We don't know what that's going to be 3 to 4 days from now. But as we stand now, yes. As far as the boardwalks, that's a municipality issue. And in one of our calls, Terry, I think that's what the governor said. He leaves those boardwalks up to the individual municipality that they are in. And we know that we just heard of one in Monmouth County that just closed just last night. So, and I think you're going to see follow suit because, you know, let's look and let's think here that if one is close to a neighboring town, it's going to put an influx to another neighboring town. So I would believe that some of our towns are going to probably follow suit, but that's a decision. I have the respect for our mayors that they do the right thing for their individual municipalities.
On the drop-off location, did you get an indication that there are supplies out there that people can or are willing to drop off? Or is this kind of a wing and a prayer type of thing that, hey, we hope you have some stuff, why don't you help us out?
Yeah, Tony. So we did get some solicitations and some offers from private companies, and some of those I will mention, i.e. Home Depot. They've already dumped off some N95 masks for us. I believe Lowe's is doing the same for us today at the Sheriff's Office, which will make their way into our first responders' hands. Retro Fitness is another one. Had a call from the franchisee of Retro Fitness, and he said, listen, if we have any antiseptic wipes from the gym, certainly you can have them. Whatever we have, you can have. So we did receive, which is why we started getting those phone calls from various. I got another one last night from a company that does the hand sanitizer. Same thing. So we just decided to have one drop-off collection point should any company wish to donate any of those items on the list, and we highly encourage it because, as you said, as you know, there's a shortage, and you know that's where that came about. So Monday through Friday, 9 to 4, Thompson Park in Middletown, and we'll gladly accept any of the donations on the list from those companies. So.
But in relation to those, if people are saying, you know, I know you've been contacting the towns, but is that how you're reaching out to say, you know, this first aid needs that wipes or?
If I may, I can go through that process briefly. It is all a chain of command process, particularly in a state of emergency. So what happens is the local OEM coordinator, emergency management coordinator from that town, will contact our Office of Emergency Management here at the county. They will put the request in, i.e. if they need 100 PPE sets for their first responder or a police officer, they'll put that request in. We, in turn, submitted requests. Our last request was for 5,000 PPE gear to the state, the Regional Intelligence Center, and the State Office of Emergency Management. I would imagine they turn it over to the feds and try to solicit that, and that's where we are not seeing the delivery from the federal government to the state on down to the county and the local. So that's why our appeal now is to our private partners and companies and corporations to pitch in, help us out with the first responders. And it's not just for, so you're clear on that OEM, so that's the way that works. And then we put the kits together like we did in here several times, and we disperse those to the local town, and then they get them to the firefighters, EMTs, and police officers. That also being said, we do have the healthcare providers to deal with on the healthcare side. Hospitals, one hospital is running low on PPE gear. They put a request in for additional reinforcements, so it will go there as well.
So as you can see, one of the biggest initiatives that we have to take part on, and which makes our life here on the county, and especially in the Office of Emergency Management is that chain of command side. And the good thing about it is our relationship with our 53 towns and their OEM coordinators and our OEM coordinator and Mike Opelgard makes it a lot easier to go through the process here and all the requirements and procedures that Sheriff Golden has put in place. So with that being said, I am going to close this out. And I want to thank my partners. And truly, you're only as good as the people you surround yourself around with. And I couldn't be more fortunate to be surrounded by the individuals behind me and all the people down, boots on the ground, that are working now. So we will continue to do our best to keep Monmouth County the safest place to be in. But we need your help. We need every resident's help to take part. When we talk about partners, this is a true partner. Because if you stay safe and you keep your family safe, everybody is safe. So again, I want to thank everyone and stay safe. Have a good day.